Our mission of the China-California Heart Watch is threefold. One is to research high blood pressure and heart disease in rural China. The second is to train rural healthcare workers. And the third is to give free clinical care to farmers with heart disease and high blood pressure. This is just briefly introduction of who the people are behind all of this. We have a volunteer board of directors, as all not-for-profit corporations must have, that meets 4 times a year by teleconference. It's an international board of directors. And we have volunteers. We're almost exclusively a volunteer organization. Our only paid staff, our administrative manager, Shanchan Chen, who a couple of you know, our nurse, Virginia Gonzalez, and our nurse assistant, Yun Wei, all of whom live and work in Yunnan Province. These are our board of directors. 5 of our board of directors are on the UCI faculty. Aside from myself, Dr. Genshin Yang is in the cardiology faculty, Dr. Brett Autry is in the School of Business. Nathan Wong, some of you may know, is in the cardiology division at UCI. And I'm in radiologic sciences and public health. We have approvals and endorsements by multiple government organizations in China. There's a lot of people are worried, oh, you're sure that the government says this is okay. We are approved by the Yunnan Province Department of Public Affairs, Department of Health, and Department of Foreign Affairs. We also have endorsement from the Chinese Cardiovascular Society. In fact, the president of the Chinese Cardiovascular Society is also the president of our board of directors. We are approved as a tax-exempt organization by the U.S. Internal Revenue Services and by the state of California, and the second highest political figure in Yunnan Province, who at the time when he endorsed us was the mayor of Kunming City, a city of 6 million people, Mr. Choha, has thanked us and publicly awarded us an award for the work that we do in Yunnan. We have equipment, some of which was donated, others of which we acquired through grants from individuals and from corporations. We have 3 ultrasound instruments, recording instruments, 2 ECG recorders, 4 pulse oximeters, and multiple blood pressure cuffs, which we use for clinical work and also for teaching. We have 2 facilities. One is a home office clinic that I own in Kunming City, which is 120 square meters. Another is a rented facility in Dali, which is 80 square meters, and we collaborate with many hospitals in Yunnan Province, in Kunming City, and in Dali City, and also with universities in the United States. We work in the country of China. It's the largest country in the world. And you all have heard of China, some of you have visited. But we don't work in this China. We work in this China. A China where villages like this one still don't have running water, don't have electricity, have perhaps 1 latrine to the entire village, and have a poorly trained, or sometimes no, healthcare worker taking care of the health needs of the people in the village. We work in a China where people still find it necessary to put this type of a notice on the wall, that it's a serious offense to drown or abandon female infants. China, we hear a lot about it on the news. We hear that it's a rich country. Well, that is not true. China is rich in its total wealth, but in a per capita basis, China is 37th in the world in terms of its GDP and its median income. You hear that the Chinese government has so much money that it could alleviate the problem of the poor people in a few years. Actually, the Chinese government per capita annual revenue is about $820 per person, compared to the U.S. per capita revenue, which is about $15,000 per person. You think about that. Of every person in the United States, the government collects $15,000 in tax every year. The Chinese government collects $820 in tax and other revenue. Not so much. They should do more. They are doing more, but not enough. But they could not alleviate the enormous health problems I'm going to tell you about, which are really a global problem. You hear that China has socialized medicine so that farmers have free health care. Actually, China never had socialized medicine. Until 1978, when the reform started, there was a voluntary health care program in China, which you had to buy into. You had to pay. It wasn't free. You had to pay. But the payments, the premiums were very low. You didn't have to pay very much. So almost all of the farmers could afford the payments, and about 85 to 95% of farmers enrolled in the healthcare program. So it was a good program. It was subsidized by the government. It took care of basic needs of public health and infectious diseases. And in 1978, it was totally abandoned, torn apart, and thrown in the garbage can. Until 2002, when the Chinese government discovered that they had a problem, that the poor areas of China were becoming poorer, and that enormous numbers of people had to spend their entire wealth in order to support healthcare needs, simple needs. For example, taking out an appendix or removing a gallbladder. It was causing people to go bankrupt just to do simple things like that. And in 2002, they reinstituted the Rural Cooperative Health Program. But they did so in a very watered-down form. So it did not cover major medical expenses, for example, surgeries for congenital heart disease, or for any heart disease. It is still improving every year. We keep track of it, because it's our business to keep track of it, because we fill in the cracks when the Chinese government can't support. So we know where it is. It's still not there. It still does not support all of the needs of the poor people. What have we accomplished since we started 4 years ago? Well, we've done significant and very high-quality research. In 2009, we published a paper in the American Journal of Hypertension. The first author of that, prime author of that paper was Ashkan Akashay. Ashkan was a medical student. He's now a physician. He was a medical student at UCI. And he did an internship. The second paper is by Dr. Jay Wang from Fudan University, a cardiology fellow, on urbanization and hypertension, published in 2010. The third was also written by two China-Cal interns, Stephen Yang and Sandy Liao, the Chinese China-Cal interns, in late 2009, and they wrote a paper on hypertension in Yunnan minorities, which was published at the end in December of 2010. Tiffany Ho, a Dartmouth intern and volunteer, worked with me for 9 months in Yunnan on the follow-up of children undergoing congenital heart surgery in Yunnan Province. These were all children who China Cal sponsored. And we published that in the Journal of Pediatric Cardiology in 2010. Right now, Shireen Khalif, who is a grad student at UCI in public health, and Lin Wen, who is a grad student in public health at Washington University in St. Louis, are working on a paper on diabetes prevalence in Yunnan minorities. We have a teaching program for village doctors. Every year we teach about 1,000 village doctors about high blood pressure, how to detect, diagnose, and treat high blood pressure. And we're trying to get funds to expand that program so we will be able to teach all of the village doctors in Yunnan Province, about 10,000 people. We have several clinical programs, one of which is called our Grants for Kids program, which helps support surgery for children with heart defects. We've now supported surgery for over 70 children since we began. Our teaching program, this is a photograph of one of our teachers. She's a Chinese-American nurse clinician from Los Angeles, teaching village doctors in Yunnan how to measure blood pressure. Some of the village doctors do not know how to measure blood pressure. Our internship program, which is the main purpose of my presence here today, and that I'm going to spend the rest of the time talking to you about. We started the internship program in 2008 and 2009. We've been doing it now for about 2.5 years, and it has been so far very successful. And during the internship program, we've done research, and I'm going to present some of the research findings of our interns, research on high blood pressure, on diabetes, and on congenital heart disease. What have we learned in Yunnan about hypertension, about high blood pressure? Well, we now know, we've got a pretty solid idea of what the prevalence of hypertension is in rural Yunnan. We know what its relationship is to ethnicity and urbanization. And these are my two authors, the three co-authors, Stephen Yang and Sandy Liu, who helped write the paper, or who wrote the paper on hypertension in Yunnan minorities, and Professor Dai Hu, who is the president of the Chinese Cardiac Society, was also an author of that paper, and is also the president of our board of directors. The purpose of this research was to determine the prevalence of hypertension among ethnic groups in Yunnan, also to look at treatment rate and control rate. I'm going to briefly present the basic results. If you have questions about it, I'd be happy to refer you to the actual published paper or to answer those questions later. When we choose our subjects, we choose villages randomly from a map in a given county. The Department of Health assigns us to a county, and we choose the villages in the county randomly. And then within each village, we get the entire list of all adults, 50 to 70 years of age in the village, and we choose 50 adults between 50 and 70 years of age. We collect historical data on smoking, alcohol use, medication use, high blood pressure, hyperlipidemia, and diabetes. We measure blood pressure 3 times, and we measure height and weight. And basically what we found was the prevalence of 39%. It's the second row right here. Prevalence defined as either a systolic pressure of at least 140, or a diastolic pressure of at least 90, or a history of hypertension of 39%. So 39% of our adults between 50 and 70 years of age in rural Yunnan have high blood pressure. How does that compare to other places in the world? We're in the United States overall in 1991 from the NHANES study, and it hasn't changed very much in the United States. It's pretty much the same. Prevalence of high blood pressure was 42%. In urban China, in 1991, prevalence of hypertension was 40%. In 1991, in rural China, prevalence of hypertension was 30%. Now, prevalence of hypertension in China in general increases by 1% per year. So it shouldn't be a surprise that now prevalence of hypertension in Yunnan is 39%.